As healthcare has consumed Washington, there are memories of the Clinton administration's failed effort every step of the way.
It's time to make sense of America's healthcare system.
We talked with a variety of people who've had a role in both healthcare efforts. There's wide agreement about the mistakes made, but that doesn't mean the Obama administration has been able to avoid the problems that seemingly any healthcare effort will confront.
You can go back to the campaign. The president was thinking about this question from the very beginning.
Healthcare reform's not something I just cooked up.
John Podesta was a close aide to President Bill Clinton, and he guided Barack Obama's transition. Like many players in both healthcare efforts, and like Mr. Obama as well, he's taken a few key lessons away from 1993.
The overall program was developed with too much secrecy.
We will sit there in front of the American people. You can watch it on C-SPAN.
Secondly, I think that the perfect, to some extent, became the enemy of the good.
You also have to have negotiations, and you have to be able to listen.
Also, while both Clintons in their separate presidential campaigns emphasized care for the uninsured, Mr. Obama in 2008 often focused as much on those Americans who already have insurance.
Part of what our plan does is also to focus on reducing and lowering costs for people who already have health insurance.
It was a crucial difference designed to convince insured Americans who are by nature hesitant to support something without seeing clear benefits for themselves.
I, Barack Hussein Obama, do solemnly
It was the same after taking office, not just in strategy, but also in policy. The president started closer to the center in the healthcare debate and negotiated, sometimes in secret, with all sides. It meant he could court rather than assail the special interests.
I want to work with the AMA. AARP is here, doctors, nurses, hospitals, even the pharmaceutical industry.
When you hit actually trying to do the darn thing, then you hit the rapids, and they've hit the rapids now.
So the bill is not ripe for markup, in my opinion.
You've got to rebuild the system.
Tom Daschle was intimately involved in 1993 and has long been a close advisor to Barack Obama, especially on health care. He wasn't able to reach agreement with Bob Dole back then, but they work together on a plan now that many see as a possible bipartisan fallback.
The situation has gotten a lot worse, so everyone recognizes the status quo is unacceptable.
But for Obama, like Clinton, the search for bipartisanship won't be easy. In fact, it's harder now.
It's only in a modern context that you would think of Bob Dole as a moderate.
The Republican lesson from 1993 is that opposing health care makes political sense.
It became a political argument. When did that happen? Sometime in, over the course of 1993.
The Democrats also keenly remember that failing to pass health care contributed to the loss of their 40-year dominance of Congress in 1994. There's determination not to let it happen this time. No! So far, it's helped them weather a tough August and a bit of sticker shock.
The president, in his June 2nd letter, said that health reform should be budget neutral. So far, Congress has failed miserably at that.
A crucial group both times were the fiscally conservative Democrats known as the Blue Dogs.
Some moderate Blue Dog members were down here earlier in the week.
Representative Jim Cooper is a member. In the 1990s, his relationship with the Clintons turned adversarial as they fought against his moderate bill. But with the current president, it's different.
That's cocktails at the White House. He has been so great to include people. The Obama administration has been much more practical. They're looking at what works, what can get done.
But a closer working relationship doesn't necessarily mean that the Blue Dogs' votes will be any easier to get.
Do you want more specifics, Congressman Cooper?
Yes, Bob, we do.
President Obama, from the campaign to his first months in office, tried to keep the debate from being chiefly about the costs of covering the uninsured, but that's where we stand today. He has to persuade Americans, many of whom are basically happy with their health care, that reform holds benefits for them. President Clinton failed to make that case. President Obama is trying to take it head on.
A lot of Americans may be wondering, what's in this for me? How does my family stand to benefit from health insurance reform? So tonight I want to answer those questions.
The task force's mission is simple: prepare health care reform legislation to be submitted to Congress within 100 days.
But President Clinton found, as President Obama is learning today, that overhauling health care takes longer than expected. The delay proved fatal in 1994. The opposition very effectively mobilized behind the faces of two people, Harry and Louise.
Having choices we don't like is no choice at all.
They choose.
We lose.
That was a unique campaign, the Harry and Louise campaign.
Charles Kahn oversaw the original Harry and Louise spot. He lobbied for insurance companies then. Now he is president of a group that represents for-profit hospitals.
And we had a good meeting with the secretary.
Some Democrats fear the summer's raucous town halls could become this effort's Harry and Louise, a metaphor for middle-class angst.
So I think it's unpredictable whether there'll be some angle that can be discovered that could cause a wedge that could all of a sudden take these little cracks that happen with every piece of legislation and make it a big fissure.
They're not going to get the ball over the finish line without his direct help and intervention.
The president will get more involved with an address to a joint session of Congress on Wednesday. But the effort has already progressed further than the Clintons ever did, and the Democratic Party's determination to do something gives Mr. Obama perhaps his best hope for success.
If you undercut your own leadership, that shortens the honeymoon and could possibly even cripple the administration, and no one here wants that.
In short, there's almost certain to be a political cost to the Democrats in doing nothing, and that may turn out to be the ultimate lesson from 1994.
How am I going to do it? I'm going to do it very carefully.